Mr. Daryl.
Hi.
All right. So to continue the afternoon session, okay, for the Philippine HR Assembly 2020, Mr. Daryl Malonzo is an academician, an HR practitioner, clinician, and a school administrator, juggling various work and capacities and effectively managing his time for all his current engagements is probably one of his best assets. He is the Chief Operations Officer of Colegio de Sebastian Pampanga Incorporated, the HR and Admin Director of the Dominican College of Tarlac, Unit Coordinator for Psychology at Maykawayan College in Bulacan. Managing his present diverse works and responsibilities does not limit him from doing other jobs. He is the HR consultant of DWPL 91.9 Bright FM and also a practicing psychologist. A founding board member of the Psychological Association of the Philippines Central Luzon Chapter, a graduate of Master of Science in Psychology at De La Salle University, Manila, and to discuss the labor laws and compliances during the COVID-19 pandemic, fellow HR and organizational leaders, we have Mr. Daryl Dada Malonzo.
Hi, Jester.
Hi, please take it away.
Yeah. So, good afternoon, everyone. Good afternoon to all our fellow HR practitioners here and abroad. I suppose we also have viewers coming from different countries. So, magandang hapon po sa inyong lahat. So, I'll be telling you things which probably you already know by now because of the different... Hi, sorry, I was kicked out from the room. Good afternoon again, everyone. So, thank you so much for tuning in to the Philippine HR Assembly 2020. And this is also brought to you by no less than, of course, Circologica, CPHR Philippines, and Luzon HR Council. To everyone who's watching, especially to all HR practitioners out there, thank you so much for tuning in. So probably I will be telling you things which you are familiar of as of the moment, probably because of the different circulars that the Department of Labor has already issued since the time of the pandemic. Okay, so we termed it as the labor laws and HR compliance on the impact of COVID-19 because apparently there are department memos coming from the Department of Labor pertinent and pertaining only to how we should manage our organizations during the time of the pandemic. So as an introduction, the first one is based from the statistics of the Department of Labor and Employment, there are more than 2.3 million workers were displaced nationwide due to the COVID-19 pandemic as of April 24, 2020. Okay? There are nearly 6 in 10 displaced workers, which are coming from the areas of NCR, Central Luzon, and Davao region. Almost 53% of these displaced workers are coming from NCR and 30% are from Central Luzon. And approximately 14%, 12 to 14% are only coming from the other parts of the country. So most displaced workers are centered on NCR, Central Luzon, and Davao region. And nearly 6 in 10 of the employed nationwide are the informal economy and are very vulnerable. When we say they are part of the informal economy, it only means that these are sole proprietors or even entrepreneurs or starting entrepreneurs, wherein partly they are also part of the employed sector, but they are still starting to make their businesses work. But because of the pandemic, then they are highly affected by this disease. And 797,729 workers were affected by the reduced incomes under the alternative work arrangements like less workdays, rotation, forced leave, and telecommuting. I've heard the previous speakers and they've talked about work arrangements in order for the company to manage its losses. However, there are approximately almost a million workers which are affected by this alternative work arrangements, which the government also needs to promulgate precisely because we want to save our economy. So these are the labor advisories and department orders which came out approximately starting January up until the present. So we have the first one, the Labor Advisory number 1 series of 2020, which was released in January 13, 2020, pertaining to the suspension of work in the private sector by reason of natural or man-made calamities. So when we speak of natural calamities or problems that we encountered by the private sector, which may be natural or man-made, then suspension of work may be a management prerogative. And during the suspension of work due to natural causes or man-made calamities, payment of wages for unworked employees would be they will not receive pay unless it is otherwise signified by an existing collective bargaining agreement or a company policy which is favorable to the employees. If and when such calamities happen and workers do not report for work, then the company may not pay these employees. But if there are ongoing or current policies that would benefit them, then you need to provide for the employees. If worked, there will be no additional pay, but it would be the management's prerogative to provide extra pay, such as what Mikel just mentioned a while ago, that it could be possible that private sectors can also provide hazard pay, but we are not required to provide such. Just when companies are or do have some to share with their employees, then we could manage to provide them with additional pays. And we have to take note that when we suspend work, there is no liability in case of failure of refusal to work by an employee. But we have to make clear what do we mean by the failure of refusal to work. Only when there is an imminent danger in terms of going to work, that's why the employee is barred from going to work. In this case, the pandemic, it might be hazardous, especially if they're coming from areas wherein the concentration of cases of COVID-19 are within the reach of their places, then most likely employees would refuse to work. As according to the Labor Advisory number 1, they're not liable for such, for refusing not to go to work because of safety reasons. Another is Labor Advisory number 3, series of 2020, promulgating the basic guidelines in the prevention of the spread of COVID-19. So these are simple steps enumerated by the Department of Labor in order for companies to promulgate to prevent the spread of COVID-19 in their specific institutions. The first one is avoiding contact. So most of the companies adjusted to this by doing contactless operations and at the same time by doing work from home. We are also advised to do frequent hand washing and avoiding visiting crowded places, especially now that our employees, some of our skeleton workforces are already reporting for work. Then we need to advise our employees and our management team as well to avoid visiting crowded places. So before and after going to work, we might have employees wherein they would go to our workplace, and after which they go directly to the malls and mingle with a lot of people. So there should be some guidelines set and parameters set by the institution by providing our employees safety rules and regulations. And the most important part is when symptoms are experienced by any employee, automatically the employer should consult a medical team expert in terms of the prevention of COVID-19. If and when there are limited resources within the company, then the company may resort to asking for help from the government, from the local or national government regarding cases of COVID-19 in the workplace. Another would be the Labor Advisory Number 4 series of 2020, which was released in January 31, 2020. These are guidelines on 2019 novel coronavirus prevention and control at the workplace. It enumerates workplace health, sanitation, and info dissemination would be cared by the institution and the HR in that manner. So in terms of propagating workplace health and sanitation, proper sanitation and dissemination of information, it is the company that has the responsibility more than the employee. So leave of absence and entitlements under Labor Advisory Number 4 tells us that workers' leave of absence may be charged to their annual leaves. So if they have accrued leaves which were not used in previous years, then they are entitled to file leaves, especially if you're already asking them to report for work, but they see the possibility of them acquiring COVID-19. What happens is that employees could file a leave. So their work leaves would be deducted from their annual leaves or accrued leaves when possible. And then employers' non-remittance. We have to remember that all companies should be paying all these mandatory benefits, especially those that are relevant to health. This would include, of course, PhilHealth and SSS, just in case there would be cases in the institution wherein an employee would be affected or would contract the virus. So if the company is not paying for PhilHealth and SSS and this government mandatory benefits, what happens is that the company has the full responsibility to shoulder the medical expenses until the full recovery of the employee. So it would be better if we are really paying all our mandatory benefits for our employees, so that when the time comes, and we're not hoping that they would that day would come where they would need to secure some remittance from these government agencies because of illnesses, then employers would have the full responsibility to take good care of their employees and to pay the full amount of expenses for the full recovery of the employees during the time of pandemic. So Labor Advisory Number 9, series of 2020, which was released in March 4, 2020, sets the guidelines on the implementation of flexible work arrangements as remedial measures for the ongoing outbreak of coronavirus disease. So I suppose it was already been discussed by previous speaker that flexible work arrangements are necessary but from Labor Advisory Number 9 in order to help the companies secure still financial stability. Some flexible work arrangements would include reduction of work hours or work days, wherein employees are given a shorter working hour reporting for work. It is also possible that rotation of workers is done or even forced leave when really very necessary. The posting and notice should be done by the HR department or the institution by properly notifying the Department of Labor. So on your screen, I have posted the exact file or the form wherein you can access it, and you need to file this work arrangements, necessary work arrangements that you took in order to prevent losses from the company. So please access them at www.dole.gov.ph and look for the COVID-19 monitoring form. So all companies who took and may be taking remedial measures for the ongoing coronavirus outbreak are enjoined to provide this particular monitoring form to the Department of Labor. So Labor Advisory number 11 series of 2020, which was released in March 16, 2020, sets the supplemental guidelines relative to the remedial measures in view of the ongoing outbreak of coronavirus. This is an addendum to the previous memo, which is Labor Advisory number 9 for the remedial measures, adaptation of flexible work arrangements. It is also a memo telling manufacturing and retail services establishments to remain open even in the time of pandemic. Leaves of absence may also be used, or existing leave credits may be used for leave of absences, and providing employees with proper identification and certificate of employment in order for them to travel from one place to another, especially if they are reporting for work. So self-employed needs a proof of business for travel, and all healthcare facilities shall be fully operational. This only means that if you are working in a hospital, may it be private or public, then all types of health facilities should remain open in the time of COVID-19. Labor Advisory number 14 series of 2020, which was released in April 1, 2020, clarifies the non-inclusion of enhanced community quarantine period on the 6-month probationary period. If we hired an employee probably January 2020 or February 2020, and by June or July of this year, they are already set to be regularized, the provisions on the Labor Advisory number 14 tells us that this only applies to all employers in the private sector, and in determining the 6-month probationary period, the ECQ, or the Enhanced Community Quarantine Period, is not included in the counting of the 6-month period. Therefore, if your employee is set to be regularized in June because of at least 1 month ECQ, then we need to extend the probationary period until July, if and when the company deems it possible and necessary. Labor Advisory number 17, series of 2020, which was released on May 18, 2020, gives the guidelines on the employment preservation upon the resumption of business operation. For companies who will be asking employees to go back to their workplaces, then the companies are enjoined to provide or to submit to health standards promulgated by the Department of Health, also by the Department of Labor. There should also be alternative work schemes. It is also possible that we offer work from home and telecommuting, and wages and wage-related benefits shall also be communicated properly with our employees, especially those who are working from home and those who are given alternative work schemes. So their wages or even their benefits could, change over time because of this accommodations that we are doing in terms of alternative work arrangements. And it is necessary that all these alternative work schemes should be handled by the HR and should be reported to the Department of Labor. So moving to the second part of this short talk would be HR compliance. So there are only 3 things that the Department of Labor wants us to comply within the time of the pandemic. Okay, so these are manifested in their labor advisories. And the first one is the Department Order number 208, series of 2020, which highlights the guidelines in the implementation of the mental health workplace policies and programs for the private sector. So this enumerates now that HRs, or maybe the company administration, should formulate mental health policies and programs for all its employees. There should be the pronouncement of the advocacy, what it is for, proper information dissemination, education and training of employees engaged in such program and policy. It is also possible that work accommodations and work arrangements would be given when an employee is deemed to have or manifesting symptoms which are mental health related. Treatment, rehabilitation, and referral system should also be included in the policy to support the mechanism of the program for the employees, securing and ensuring our employees that they are mentally healthy, and at the same time that the institution or the corporations would have their programs for mental health. The Joint Department Order Series 2020, which was released in May 1, 2020, in cooperation with the Department of Trade and Industry. So the DTI and DOLE interim guidelines for workplace prevention and control of COVID-19 tells us the following guidelines, which should be included in our reporting for our OSH, okay, for our OSH report. So the duties of employers should provide necessary policies of the prevention of COVID-19. I suppose at this time your institutions have already formulated the policies regarding the possible prevention or the prevention of COVID-19. We are also enjoined by the Department of Labor and the Department of Trade and Industry to provide resources and materials needed by the employees. Specifically, these materials are the PPEs, or for basics, we have the masks and even alcohol, or for sanitation purposes, we have tissue and the like. So COVID-19 testing kits are not necessarily being forced by the government to be done by the private sector. However, they are trying to tell us in the private sector that if we would want to really help our employees, we might also provide testing kits for COVID-19. We need to designate safety officers. We need to enhance health insurance. Probably a lot of us may already have health insurances, but when possible, as according to the Joint DO, we would want to expand the coverage of the benefits. So where feasible, we provide shuttle service. So if the company is willing to provide services, especially those who are commuting, for employees who are commuting, then it is our duty and responsibility as the institution to provide shuttle services for our employees. Enjoin the hiring from the local community and put up a COVID-19 hotline. So the worker's responsibility vis-a-vis the employer's responsibility would, 1, to comply with the workplace measures, 2, observe proper respiratory etiquette, 3, coughing and sneezing into tissue is necessary, 4, disposal of garbage, proper disposal of garbage is recommended, and of course, disinfect at all times. In the COVID-19 testing, employers may test workers for COVID-19, but it should not be forcefully done. Company policy on COVID-19 testing shall be formulated and agreed upon by employers and workers. So in formulating our policies and prevention of COVID-19, what we need to do is to consult also our employees regarding the possible policies or recommendation based on our policies, because apparently it could be possible that we would ask our employees to run through COVID-19 testing. However, it may violate their rights, especially to right to privacy. So we need to consult our employees in the formulation of our guidelines for our policies for the prevention of COVID-19. And lastly, and sadly, I must end with this particular foregoing policy, which is the applicability of the Philippine laws and labor regulations during the lockdown or quarantine. So no less than the Labor Code recognizes retrenchment as a right of the management to meet clear and continuing economic threats or during periods of economic recession to prevent losses. When the management decides that the company is losing a lot because of the pandemic, then it could resort to retrenchment. So how do we really define retrenchment? Based from the case of Waterfront Cebu City Hotel versus Jimenez, the Supreme Court had the occasion to define retrenchment. So retrenchment now, as defined by the Supreme Court, is the termination of employment initiated by the employer through no fault of and without prejudice to the employees. It is resorted to during periods of business recession, industrial depression, or seasonal fluctuations, or during lulls occasioned by lack of orders, shortage of materials, conversion of the plant for a new production program, or the introduction of new methods or more efficient machinery or of automation. It is an act of the employer of dismissing employees because of losses in the operation of a business, lack of work, and considerable reduction of the volume of its business. So we in the HR, although we're not advising HR practitioners to do retrenchment, when it is necessary, we can do so. But there are prerequisites to it. Aside from that, when doing retrenchment, we need to comply with the legal procedures for it. First, retrenchment is to be undertaken to prevent losses which are not merely de minimis, but substantial, serious, actual, and real, or if only expected, are reasonably imminent as perceived objectively and in good faith by the employer. So it only means that we can do retrenchment if and when it is found that there is an actual and serious substantial loss of the company because of a certain phenomenon. In this case, we have COVID-19. The employer serves written notices both to the employees and the Department of Labor at least 1 month prior to the intended date of retrenchment. So to be technical about it, we need to provide our employees being dismissed at least 1 month notice for the retrenchment. 3, the employer pays the retrenched employees separation pay, equivalent to 1 month pay or at least half month pay or every year of service, whichever is higher. So automatically, if we do retrenchment, we need to compute for separation pay of the retrenched employees. This should also comply with the Bureau of Working Conditions as promulgated in their annual or semi-annual manual in terms of the separation pay and other benefits accorded to the employees. Number 4, the employer must use fair and reasonable criteria in ascertaining who would be dismissed and retained among the employees. And lastly, the retrenchment must be undertaken in good faith. The last and final procedure should always be complied with, that it should be undertaken in good faith. We are not doing retrenchment based on our bias, but because there is a need to safeguard the institution's financial stability. That is why we are doing retrenchment. So with that, I am ending my presentation on labor laws and HR compliance on the impact of COVID-19. So for questions and queries, you may visit the following web sites: Facebook, Gmail. You can mail me through my personal email, and also you can connect to me through my LinkedIn account. So Jester, thank you so much, HR people, for this very wonderful avenue in order for us to collaborate and to think of our policies and procedures to be employed in our respective companies. Thank you and God bless.
All right, thank you. And keep safe. All right. Thank you, Mr. Darrell, for a very informative session. Please stay connected as we have 2 questions for you from our viewers. Please try to shed some light. Would it be okay?
Yeah, sure.
All right. So we have a question here from GLG Bellido. No? How can you give bonuses or incentives to employees since most of the companies experienced business loss? We employees should also understand our employer. So again, how can you give bonuses or incentives to employees since most of the companies experience business loss?
Okay, so when we say bonuses, of course, these are non-required to companies to provide. Only when there are funds available, that's when we give this additional bonuses to our employees. So the private sector or even the government is not mandated to provide bonuses when there are no available funds. But securing funds, probably you might have a tie-up with a multinational company and they're providing you sources of funds, then you may provide your employees with a portion or a fraction of the subsidy that they are providing when necessary.
All right, thank you for shedding some light. Last question from Tin Tria Koizumi. Are employers required to provide COVID-19 testing kits?
It's not necessary for, so far, there are no government rulings requiring all companies to provide testing kits. But if we have the ability and at the same time the facility to do such, then we would, of course, we would want all our employees and stakeholders to be safe whenever they are reporting in their workplaces. So definitely, if we have the source, the funds, and at the same time the facilities to do so, then we would employ COVID-19 testing. That would be something of value to the employees because they would realize that there is a true care coming from the employers.
Thank you for that. Since this topic is very technical and very and very critical, marami tayo nagtatanong. So you can ask directly Mr. Darren Malonzo regarding your questions. He will be putting his Gmail here sa comments. He'll try later so you can ask him directly.